The other software platforms that sit there, have the element of telling you what to do, but we today in the world need to be shown or helped, and that's where it gets stopped. We're told to put a policy in place, we're told to put a procedure in place, we're told to put a risk assessment in place. Can somebody help us do it? Can software help us do it? Can technology help us do it?
I think there's a lot more we can do to publicise what's available and how it might be used. Case study examples really help, where people are using technology and using it well and seeing some benefit. That's really helpful, I think. But we need to encourage people always to go back to first principles and adopt a risk-based approach, so that they're really focusing on what the problem is that they're trying to solve and then finding the right solution.
Small to medium-sized construction businesses have always struggled with health and safety, and they see it as an exercise sometimes just to get on site, missing a lot of the point behind health and safety itself. So for our customers, when they're using our software, all of a sudden health and safety becomes accessible. It's removing that burden and the barrier behind completing these assessments in a certain format, and it's getting them to focus and really holding their hands along that process to complete their risk assessments, method statements.
But I think one of the conversations today that I think resonated around the table really was in relation to you still need people. So we're here to try and help performance. We're looking for software solutions that will allow managers to manage better, allow companies to understand their organisation better, manage risk better. But you still need the people involved to do those tasks, and behaviour and culture are two huge parts of that.
I think at the moment, certainly some of the technology is in its infancy, but as I say, there's got to be a starting point. We need to move forward, and I think it's clear that the app can help to get the safety message out there in the field to the people that are actually carrying out the work, and that's important.
Well, I guess you would assess the role first, say, okay, what's the role? So say it's a bricklayer, for example. Lots of musculoskeletal injuries with bricklayers historically, and just looking at how their work process, what is it within their work process that is resulting in these MSDs further down the line, and just studying muscle movement and obviously collecting that data from a variety of individuals, and putting it all together and seeing where the sort of stress points are.
I think there's still lots of scope for improvements in usability. I think one of the problems is we've had an explosion in functionality, and inevitably the more functions you throw into something, the more difficult it's going to be to use, because you've got to decide which functions you want to use to start with. I think some of the new technologies coming along will help to simplify that.
Technology can only support it because ultimately people have got to use it, and it's got to get over that behavioural issue, because people will find ways of switching off the technology in the same way as they bypass safety devices which are provided for their protection. So you're moving along the road to showing that you've done everything reasonably practicable.